The University of Georgia just released a shocking new study that found that white people care less and even resist COVID-19 safety protocols and precautions when they learn that COVID disproportionately impacts Black people. To put it plainly, the study found that white people believe that COVID is not a white people's problem, so they could care less about Blacks contracting and dying from the virus. Y'all know I had to talk about this when I saw this study, and today I have one of the co-authors of the study, my team of experts, and a Black person who recovered from COVID and unfortunately lost two of his family members to the virus. All of this coming up next.
Live from Los Angeles, this is the Special Report with Areva Martin.
COVID has ravaged the Black communities literally all across this country since its inception. Now, experts say the disproportionate impact on Black people is not because of anything that we have done or because of our biological makeup, but it's because of systemic racism in healthcare. Researchers' efforts to inform the public of these structural inequities backfired. Instead of the news of Black folks dying from COVID at alarming rates invoking empathy and care, it prompted white folks to consider themselves less vulnerable to the virus and to adopt a "I don't give a damn" attitude. That's a Black person's problem or Black people's problem. It's surely not a white people's problem. What do researchers make of these results, and what does it tell us about the state of healthcare in this country, about the state of our current COVID policies, and generally about the state of our nation? Here for our leadoff discussion is Dr. Allison Skinner-Dorkenoo. I'm gonna get that name right. She is a professor of psychology at the University of Georgia, and she's one of the co-authors of this study. Good morning and welcome, Professor.
Hello, thanks for having me.
Wow, I don't even know where to start with this study. I saw several articles written about it in national news outlets, and it just floored me, to be honest with you. I was shocked by it. I was upset, I was angry, I was mad. I had this range of emotions, and I'm so glad that I'm able to sit down and talk with you, one of the co-authors, to help me understand if the emotions I'm feeling are justified. But let's start with the study. What prompted your team to conduct this study?
Well, it really sort of started from back when news about the racial disparities in COVID-19 first started coming out in late March or April of 2020, and I shared a couple of those articles because that was really concerning and upsetting to me. I shared them, and actually a friend of mine wrote back to me and said, I don't know if you should be sharing those. He was kind of concerned about what implications that might have. And that got me thinking about what, from a psychological perspective, what impact might sharing this information with the broad public, and especially with white people, what impact that might have. And so I got together with my graduate students, and when we started thinking about it from a psychological perspective, it was rather concerning. And we started feeling pretty worried that it could actually backfire and lessen concerns about COVID-19 among white people. And given that white people make up the majority of the US population still, that could have pretty big impacts overall on our policies and so on.
Yeah, not just the majority of the population, but definitely predominate in policy-making decisions, in those places where policies are decided, whether it's the US Congress, the US Senate, the White House, healthcare facilities, the CDC, the FDA, all of these people and institutions that are making decisions about COVID are predominantly, they're white people that run these organizations. So you shared the article, you got the feedback from your colleague, you went to your graduate students. So tell us about the study. How many people involved? How many months did it take? What was the process of the study?
Yeah, so we actually conducted two studies. The first one was done in October of 2020, so it took a few months for us to put everything together. And our first study, we just wanted to measure, and we collected data from 500 white people from throughout the US. And we initially just wanted to see if how aware they were of racial disparities in COVID-19, predicted how fearful they were of COVID-19, and how much they supported safety precautions. So things like wearing a mask, social distancing. And so initially we just wanted to sort of measure how these things were related. And in this first study, we found that they were related. So the people who were more aware of racial disparities in COVID-19 cases and deaths were less fearful of COVID-19 and less supportive of safety precautions. So that was pretty concerning. It was what we predicted, but still really upsetting and terrible for all the reasons that you were mentioning earlier. But then we really wanted to see from a causal perspective, was exposure to this information leading them to be less fearful? So was it actually impacting them in that way? So then we designed a follow-up study that was run shortly afterward, around the same time, I think it was November of 2020, that we had different articles where we told people, where we just talked about COVID-19 in one of them, that was sort of a comparison article. And then other ones where we exposed, we provided information about racial disparities in COVID-19. And that was not just racial disparities experienced by Black US residents, but also Native American residents, Latinx residents. So really sort of showing that white people are less impacted than these other groups according to these metrics. And what we found, and we had two different articles. One of the two different articles that talked about the disparities, one of them just mentioned the disparities, the other contextualized in sort of systemic issues. So sort of mentioning this is a result of longstanding systemic issues that have been going on for some time in terms of racial health disparities. And we did this in part to try and undermine the idea of sort of blaming the victims here, of sort of saying, well, Black people are being irresponsible, those sort of ideas. So we're trying to undermine that by referencing the systemic issues. But unfortunately, what we found is that the people who were exposed to these articles about disparities, even the one that mentioned the systemic stuff, they were less fearful of COVID-19, they were less supportive of safety precautions, and had less empathy for people who were vulnerable to COVID-19. So yeah, it didn't help, and it didn't help to provide that systemic information, at least the way we approached it, unfortunately.
So what do you do with a study like this? You get this just really disheartening, disappointing, just horrible. I can't even think of the adjectives for it. You are a researcher, you're a professor at a major institution. What do you do with this data?
Yeah, well, we felt like it was really important. So we were trying to get it out into the public so that, hopefully we could conduct more research to figure out how to, and not just us, other people as well, to try and figure out how can we bring attention to disparities, because they need attention so we can address them, but not have this backfire effect where actually we lose the interest and the motivation of sort of important decision makers. And so one thing is sort of raising awareness, and that can also, hopefully not just spur more research, but also maybe some greater mindfulness and intentionality about when we're sharing this type of information, who we're sharing it with, and how we're talking about these things, and whether the way we're talking about them might actually be, unfortunately, making the problem worse.
Yeah, so I'm thinking about 2020. So you said you conducted this study in October of 2020, right? One of the first ones. So
Yeah.
I'm thinking back to April of 2020. If you'll recall, it was around April when the then U.S. Surgeon General, Jerome Adams, at that press conference invoked those horrible racial stereotypes during this news conference, basically talked about the social ills contributing to COVID. He made reference to Big Mama and something, talked about Black folks avoiding alcohol, drugs, and tobacco. And we know that he was widely criticized for that, but Do you think that having the Surgeon General with all of his stature and all of that, what comes with being the Surgeon General, making those derogatory comments and basically saying that Black folks are dying and getting COVID because of their lifestyle, because they drink too much and they smoke too many cigarettes, do you think that played a part in what these study participants were responding to?
Yeah, perhaps we were trying to avoid that by talking about the systemic issues, but that's exactly the kind of thing that we were trying to address. And I do think that making comments like that are really harmful, and maybe even more so because they're a bit veiled. So he didn't come out and say something really, really blatantly racist of like, yeah, I don't know. I don't have to make up an example of that, but it was sort of vague of, like you were saying, the big mama, and saying these sort of vague references without really explicitly blaming Black people. And the problem with that is that if it had been more explicit, a lot of people might have paid more attention, like noticed that there was something really problematic about that. Lots of people noticed there was something problematic, but perhaps white people would have noticed there was something problematic.
Yeah, I was going to say, you mean like white policymakers, because we were very clear in the Black community. I mean, we drug them on Black Twitter for like months.
Right.
And I don't mean physically, but I mean, we talked about it in the Black community, news people, media people. So we were very clear. It wasn't veiled to us. We knew what he was talking about because we've heard those tropes, they're played out over and over again. So they get very familiar. But you're saying
absolutely
the fact that it was somewhat veiled gave cover to white policymakers to ignore it.
Yeah, but then we can kind of go, what do you mean? There was not any, that, white people can sort of say, no, there was nothing. He didn't say anything. I didn't notice anything about that, because it's a bit like a dog whistle. It's a very sort of subtle way of cueing all these stereotypes that people who aren't paying attention and concerned about it, they're going to miss them. But they're still going to be influenced by them. They're just not going to be aware that they're influenced by them.
Yeah, and you have to believe that the outcome of your study, which basically says non-white lives, Black people in particular, are not worthy of protection. So I'm not going to wear a mask. I'm not going to support COVID safety protocols because I'm not getting COVID and my community is not dying of it. It's that the othering, which we see a lot, it's happening to those other people. How do we know, and maybe we already know, and you are a researcher, maybe you know, that how impactful are these kinds of thought processes on the decisions that have been made today about lessening COVID protocols? Because now you have to start to ask, is COVID quote unquote over because COVID is a Black person's problem and not a white people's problem? Is that why we said no masks, no vaccines, no everything, go back to your daily lives?
Yeah, I mean, it's hard to directly connect those two things to say for sure that this caused this, but I know that there was a shift in the public opinion poll data after the information about the racial disparities came out. So between like April and June, there was specifically among white people a shift in terms of like, oh, we got to open up the economy. That's the most important thing. And that became the top priority. And at the exact same time, we're getting increasing numbers of articles coming out about racial disparities. So it's those two things were happening at the same time, and it suggests that they might be related. There was also a study published by researchers at University of Washington, and they found that states with higher populations of Black people opened sooner. So like they had their basically sort of removed their policies of sort of severe COVID-19 restrictions earlier, the higher the population of Black people.
Wow. And you talked about that shift. So the shift that you identified was the shift in attitudes, like we can get back to work now. Was that the shift that you saw?
Yeah, I mean, we weren't looking at it in a time with our particular study, but yes, I think that's what the evidence from these other studies suggests. And then we didn't specifically ask about things related to work or the economy in our study, just about masking and specifically like the social distancing precautions, but those have to obviously are interrelated.
In the research that you've done, have you ever seen anything like this? In the years, I don't know how many years you've been at this. I imagine it's, several, but have you ever seen anything like this? It's just so shocking to me.
I mean, I think maybe there is evidence of this in other areas. So, for example, there has been work looking at exposing people to white people to information about racial disparities in the prison population, the incarcerated population, and essentially what they found in these studies was that when white people saw representations of the incarcerated population, which were fewer white people and more people of color, so more Black and brown people, that they were less supportive of reforms to the criminal justice system than when they saw representations that showed more white people being incarcerated and involved in the criminal justice system. So it was sort of more alarming and concerning when there were fewer racial disparities as opposed to more racial disparities in terms of incarceration.
How can your work be used? We're in this moment in this country, we're having this kind of national dialogue about systemic racism, structural racism. That's taking place at the same time. States like yours, other states, counties like Orange County in California, where I live, are enacting and imposing these restrictions on what we teach about race, about racism in this country. And if we're not talking about race and racism and teaching about it, and we're restricting that, but we have studies like yours, how do we ever get to a point where we start to challenge these policies that for sure in some ways are being impacted by racial animus?
Yeah, and I don't think those two things, like, it's not an accident that those two things are happening at the same time. I think that there is an awareness on some level of the power of history, of the power of talking about history, talking about systems. And that's something that I have looked into in some of my other research, is trying to see, like, what is the impact if we educate people about these historical racial injustices and help them better understand the context, which often is not provided in our education system, and that it matters. It makes a difference that people who are already more aware, but also if we expose them to information so that they become more aware, even just in a particular day, like if they just learned about it, they report more awareness of systemic racism and also more support for policy change in a variety of different areas. So I think that really matters, and sort of keeping up, pushing and resisting and trying to make sure that the history and the systems are talked about and that we don't let that be silenced is really, really critical to moving forward.
Wow, you just made some really critical connections that I don't think I've heard made by anyone else. So thank you for that. Very insightful connections between this movement to suppress history, because before George Floyd was murdered, we weren't having these conversations about structural racism and systemic racism, and now they're all being painted under this broad umbrella of critical race theory, which we know is just farcical. But this movement now to suppress that history, this study that shows less empathy, lack of care, and the policies around COVID changing and shifting, just shows that the power, as you said, the people in the know the power of this information, and the people that don't know, which is unfortunately most Americans who are not in academic settings like yourself, or who are not just reading and following this very closely, don't have a clue.
Yeah,
how do we help them, Professor? This is scary. We got a job to do. We got to save the world. You and me in this show right now, here today. Oh, I'm making light of this because it's really so just mind-boggling that I would be screaming at the screen if I didn't make light of it, I think.
Yeah.
Not at you, because I'm grateful to you for exposing it and having the courage, because your colleagues said, don't touch this. This is dangerous. Yeah, so think about that question. Well, let me ask you, have you gotten any backlash yourself from even producing this study?
No, not yet. I can imagine that some might come at some point, but so far, no.
Good. I'm glad to hear that. Okay, well, I don't know. Where do we go with this big connection you just made? Where do you go? Next study? Do you do another study? Do you keep trying to push this one out? What do you do? What's next for you?
I mean, I think that one step would be to try to do additional research about this specific issue of how do we communicate about disparities, racial health disparities especially, but I think also thinking about lots of other disparities, even things like climate change, of who's being disproportionately impacted by climate change, and try to figure out how we can talk about those things in a way. So thinking about, are there ways that we can weave in some of the stuff we were just talking about in terms of history and talking about injustice, of really highlighting those things when we talk about racial disparities in a variety of issues, to help undermine the perception that sort of, well, that's just the way it's always been. What are we going to do about it? And instead go, no, this is unjust, and it was created this way. It didn't just happen this way. There was a system that was built that made it be this way, and it's unjust, and therefore it's our responsibility to do something about it.
Yeah, great words of wisdom. Great way to end this segment. Thank you so much, Dr. Allison Skinner-Dorkenoo, for the work that you're doing. Thank you for having the courage to publish, one, to take this study on, and then to publish it. I hope by having this conversation today, we elevate it more, because I did find a couple of articles about it, but it's not like I've turned on. You know, of course, the war is dominating most news coverage right now, but this is really big enough that we should be talking about it on a much broader level, particularly when we have people like our former Attorney General, Bill Barr, doing big national interviews saying that he doesn't even believe that systemic racism is a problem. So we've got to be able to counter those narratives and have these conversations on the same national platforms, international platforms that someone like him is taking advantage of to deny what you know and I know and most educated people, and he knows too, because he's a smart guy, that systemic racism is a real thing, and it's driving policy even around something as deadly as COVID. So again, thank you for sitting down with me this morning, and we'll continue to follow you in the work that you do, and say congratulations and thank you to those students of yours as well, because I'm also grateful to them for their contribution.
I will. Thank you so much for having me.
Okay. My next guest, we're talking about history here. His name is Dr. Jim Downs. He's a professor at Gettysburg College, and he's a historian. He's written a couple of books. One is called The Maladies of Empire: How Colonialism, Slavery, and War Transformed Medicine. And he's written Sick from Freedom: African-American Sickness and Suffering During the Civil War and Reconstruction. Good morning and welcome, Dr. Downs.
Thank you so much for having me.
So Dr. Skinner-Dorkenoo just said something really powerful. And she said that the powers that be know the power of history. And they know that if more people learn about the history of slavery, the history of racism and systemic racism, particularly around healthcare, which is what we're talking about this morning, that will cause there to be a challenging and questioning of existing policies, and maybe a leveling of sorts of the playing field. What do you make of that as a historian? It's something that I'm sure you've known all your life, but now that everyday people are being able to be exposed to that, how important is this?
Well, I think if you look at the study and you just read it on its own terms in isolation, you think, oh, well, this is just accidental. This is an aberration. This is not this is surprising, but it's just an outlier. But when you place it within context, you realize it's a continuation of an ongoing tradition around how Black people have been treated in terms of their healthcare in this country. I teach at Gettysburg College. I'm a Civil War historian. I'm a historian of medicine. What most people don't know is that the Civil War, when Lincoln emancipates enslaved people, over 60,000 died from a smallpox epidemic. You don't know that because the powers that be that are erasing these COVID disparities erase that epidemic. I, without patting myself on the back, I pieced together that epidemic, and I showed how so many enslaved people died at the moment of freedom and then died from a cholera pandemic. All of these histories were erased, so that when we get this history of Lincoln, when we get this history of Civil War, it's a whitewashed history. It's a whitewashed history that has refused to acknowledge the long history of how epidemic disease has hurt Black people. And here's the thing, Lincoln knew about the smallpox epidemic, and members of Congress knew about it, and they turned the other way. They turned to focus on other issues. Now, this moment leads to citizenship, it leads to suffrage, it leads to these major revolutionary moments. But the sort of systematic effort to push aside Black suffering is not new. The systematic effort to erase Black sickness is not new. And so when the pandemic was starting to come to a close, we thought in July of 2021, I wrote an article for The Atlantic, and I said, we have to be careful. If we use history, we can show that pandemics often are considered over when they no longer affect white people, and when the victims are only Black people. And then the other issue is we use this idea of race to cover up the structural inequities. You know, I got so upset. I'm a historian of quarantine. I'm a historian of lockdowns. I've been working on this for a very long time. White people were rejoicing about being on lockdown. They were happy to stay home. They were happy to stay in their little pods. They turned their garages into fitness centers. They bake banana bread. They run Instagram. They ignored the fact that it was mostly people of color who were picking up their garbage. It was mostly people of color who were at the grocery stores. It was mostly people of color who were filling their prescription and stocking the shelves at Rite Aid. And then when you have a population of people who are in direct contact with the public, of course their rates of COVID are going to increase. It's not because they're increasing because they're Black and the race makes them different. They're increasing because they have been exposed to the public. They haven't been isolated. And so then the study comes out, as you said, with Barr and other people. Oh, well, it's mostly Black people. It's a result of, this sort of dog whistle to racial difference. No, it's the fact that the labor demands have placed Black people in direct contact in the public. They haven't had the opportunity to be on lockdown. They haven't had the opportunity to quarantine. And so, of course, their rates of infection are going to increase. And so people often sort of fail to sort of see these larger systemic issues that both have led to crises in the Black community and have also led to the erasure of crises in the Black community.
Thank you so much, Dr. Downs, because you're right. No one that I know has ever told me, oh, it was such an interesting chapter in our history book when we talked about the slaves who died from smallpox. I don't even know. It's so many folks have gotten such a sanitized, watered down history of slavery and the aftermath of slavery. Now we're in this moment, Dr. Downs, where there's even greater effort. You can't pick up a newspaper. I was reading my digital. I read like 10, 12 digital news outlets a morning before I start the show. And here in my own county, or here in Orange County, which is adjacent to me in LA County, right, a big school board meeting, parents, white parents screaming and shouting, demanding that this school district ban critical race theory. Mm-hmm. Now, I bet you if you did a survey in that room with those parents and asked them to define critical race theory, right, probably zero could
right,
give you an accurate definition. But it's right, become this dog whistle, it's become this umbrella term, which basically is being weaponized. That's right, and used to say, we don't want to teach Black history, period. So right, if we're not teaching this history, how do we know, or how do people know that when these policies are enacted, like COVID is over policy, that it's really based on racial animus and a past of systemic and structural racism? How do we get that word out? I'm really worried.
Right. Listen, I think there's a couple of different things. I think one, just you documenting it and talking about it on the show today is really important to put it in the public record. This conversation is happening. Second, I think that it's absolutely right to really just push back as hard as you can on getting people to say, what do you actually mean by critical race theory? Because Fox News has created this as a sort of term that sort of shuts down the teaching of the Reconstruction Amendments. Let's understand something today. Reconstruction, the end of slavery, brought about the 14th Amendment that defined birthright citizenship. When we're talking about other periods in American history, from immigration to issues today at the border, we're talking about what defined citizenship. It was 4 million formerly enslaved free people that stood and demanded at the end of the Civil War to be counted as citizens that actually changed the definition of citizenship. So to teach Black history and thereby to teach the 14th Amendment and to teach, it's not to teach critical race theory, it's to teach US history. It's to say that our understanding of the 14th Amendment, which is central to so many other discussions, even outside of African-American history, resulted from the experience of formerly enslaved people demanding political recognition at the end of the Civil War. And so we have to push back on critical race theory because that's become, as you said, weaponized to shut down what happened in US history among Black people. And that's key.
And doing so basically says Black people aren't even a part of U.S. history.
That's right.
Because if we can't talk about what, Reconstruction and the 14th Amendment and the treatment of African Americans coming out of slavery and slavery itself, then we othered Black people to the point where we don't even exist in American history. But I want to ask you this, Dr. Downs, on this issue of COVID policy, who else is talking about this? Because you just said you wrote an article in The Atlantic.
Right.
Obviously, we have this new study coming out of the University of Georgia with Dr. Skinner and her team, but I'm not hearing a lot of scholars, a lot of historians, a lot of even race scholars raising, sounding the alarm that these COVID policies might be, or probably are, we can say with some degree of certainty based on that study, tied to this history of healthcare racism.
So I would say that, as you know, the media landscape is really crowded, and historians are willing and able and are using social media and have been trying since Jump to do this. There's a podcast called COVID Calls, Daily COVID Calls, and it's historians, it's epidemiologists, it's people committed to race that are doing it. There's a brilliant scholar by the name of Monica Green, who's an African-American woman who studies plague and Black Death in the medieval period, and she draws connections constantly. And her work is brilliant, and it's very smart. But she does little tweets that break it down, that make it clear, that make it legible. So even though she can speak in a really sophisticated scholarly register, it's there. I will say this. I will say that when COVID first broke out, I wrote this article for The Atlantic in July of 2020, but I wrote 2021, but I wrote another article in March, and I was getting a lot of calls from NPR, from various media stations, and all people wanted me to say was this was Trump's fault. And it's one note.
What was the article about?
The article was about how we have sort of erased the smallpox epidemic, how we have erased other epidemics, how we need to use the past as a framework to contextualize and understand what's happening with COVID. Because from a historical perspective, none of this is new and none of this was surprising. And historians had lots to say. And every time they called me, they just wanted me to say, well, Trump was evil. I'm like, I established that in print in Slate and in the Washington Post in 2016. We don't need to repeat that. This is a pandemic. Like, this is beyond just.
So they didn't want to hear.
They don't want to hear
talk about the history.
They don't want to hear
pandemics or epidemics as it related to African Americans. They didn't want to talk about that.
They don't want to do it, but the historians are there. I mean, we are here. We want to be heard. That's why, I jumped on this to do this. We're willing to do this. We're willing to come out. We're willing to talk. We're willing to help frame and contribute. We are in our own associations, in our own classrooms, in our own work, addressing this. The question becomes, within the broader media landscape, are we going to be the shiny object that people want to set in the conversation? Or are they going to turn to something else? And as you're saying today, the coverage right now for all kinds of justified reasons is moving to the Ukraine. That's not surprising. So it was something like this. It was like the day the United States made a claim about Ukraine and Russia, the next day, the CDC sort of announced the sort of lessening of the masks and everything else. as a historian, I'm like, of course, Americans can only hold one narrative. First, it was the war on COVID. Now it's the war in Ukraine.
And they put poor Dr. Fauci, I keep laughing that he's like in witness protection program or something.
Yeah.
The guy that we saw every day on our television sets,
Right.
we haven't seen him in like 2 months.
Right.
Nowhere, period.
Exactly. And also I want to just, because I live in Gettysburg, but I'm close to Philly. I also want to say that one of the things that's happening too is just the erasure of Black people's own political mobilization around COVID. And so in Philadelphia, there's actually a group founded by Black doctors who are out there providing testing and vaccines. It's a consortium. But so the media then plays on this idea of, oh, there's racial differences between Black and white people. Okay, that's a 19th century myth. What they're doing by giving that airtime is actually obscuring the work within Black community by Black physicians. So if you just listen to the media, you would say, oh, Black people are reluctant, they don't want to get tested. You don't see the hard work on the ground of Black physicians going in the Black community, setting up vans, trying to do the work of testing and vaccinating and educating. So some of this conversation around race has also gone in a terrible direction, which is to constantly measure mortality rates and morbidity against white people, which obscures the work that Black people, Black doctors, Black community activists are doing to raise awareness within the community. So I think that's also important.
That is such an excellent point. Thank you so much, Dr. Downs. You are so much insight here, so much great information. I'm just sitting here thinking of the million people that I want to share this interview with, because you have just raised so many significant points that don't get raised enough in the mainstream media. But we're definitely at the Special Report always trying to uplift these stories and bring on historians like yourself who can help people, because knowledge is power. And
Absolutely.
There's an effort in this country right now to make us all dumb, to make us stupid, to make us blind, and to cause us not to care about our history. And that's very dangerous.
That's right.
And we've got to fight back against that with everything in our being. We have to remember our history, because it definitely is informing our present and our future. Again, thank you for your books. Thank you for your work. And I'm going to have you back. I'd love to talk more about the Reconstruction period. I'm a history buff, so I'm really fascinated by that period and that smallpox that killed 60,000 people. Definitely have to talk more about that. But again, thank you so much. Great books, Sick from Freedom and Maladies of Empire. Make sure you go to Amazon, every place books are sold, and check out Dr. Downs and support him and support his work, because that's how historians like him get to do this work, is because of the support they receive from people like us. So again, check them out.
Thank you.
All right, my next guest is Keith Gambrell, and I want to have Keith back because Keith experienced some of this racism that we're talking about. He lost his father and his grandfather, unfortunately, early on to COVID, and he himself had COVID. His mom had COVID, pretty much his entire family, and he had some horrible experiences at hospitals with white doctors and nurses. So I want to give a face to what we've been talking about. Good morning and welcome back, Keith.
Hello, good morning. Thanks for having me.
You look great, Keith. It looks like you had a full recovery from COVID. I hope your mom and the rest of your family are doing well. But when you listen to this conversation we've been having this morning and you hear about this study, white people saying, hey, that's a Black people problem. We don't care. We're not going to wear masks. We don't want to socially distance. We don't care about vaccines. How does that make you feel as someone who suffered so personally, losses from COVID?
It makes me feel upset, angry, bitter, because millions of people died, and you have a whole race of people who don't care because it didn't affect them. They didn't lose fathers, they didn't lose brothers. And if they were sick, they were able to get into the hospital to get proper care, They weren't pushed to the back of the line to get help, So it for sure makes me upset. But I seen it early on, first wave. I knew it was a race thing with how many Black people were dying, minorities were dying. It was just it's really just a slap in the face every day, And then just how upset certain races get over a mask is another slap in the face. Like, you may not get sick from it, but the next person you come in contact with may go home and spread it to their family, and someone may not wake up one day, But they don't see it like that because, once again, it's not affecting them, and they're able to get the help that they want and need so much. So.
Yeah, I remember, Keith, the story you told us about taking your mom to an emergency room, and just remind everyone of that story. It was so
So 6 hours after my dad died, my mom comes down with a fever. Her fever is probably 103, 104 at the house. So we take her to Beaumont Hospital. It's located in Grosse Pointe Farms, which is one of the richest cities in America, if you look it up. My mom's in line. There's a white lady in front of her. The white lady tells the screening nurse while she's at the hospital, I got some sushi off Grubhub. I think I have food poisoning. I need to see a doctor. They take her right in. Now here it is. My mom has a prescription to get tested for COVID. She has a fever. She's vomiting outside of the hospital. You know, we tell her my dad just died from COVID. Send my mom home. They go, oh, just go back home. You're fine. Drink some tea, stay hydrated, take Tylenol. Wouldn't even let my mom in the hospital. So I had to take my mom probably about 10 miles across town to Henry Ford. And thank God they kept her and took care of her. But yeah, Beaumont didn't want to help.
Wow. Every time I hear that story, it just breaks my heart. Oh, man. And I know it's not an anomaly. I know it's not a singular story. It's the story of so many African Americans during this period. I want to bring into the conversation Dr. Monica McLemore. She's the editor-in-chief of the Health Equity Medical Journal, and she's also a professor at the University of California, San Francisco. And she was a clinical nurse for 28 years. Dr. McLemore, Keith's story of his mom, how many times have you seen that in your 28 years working in a hospital setting?
Well, first of all, thank you for having me. I predicted all of this was going to happen. And so like Dr. Downs before me, I published a piece in Scientific American on March 26th of 2020. And that piece was entitled, COVID-19 is no reason to abandon pregnant people. Why would I write something like that on March 26th of 2020? Because we were already in an existing Black maternal health crisis where Black women are 3 to 4 times more likely to die during pregnancy and childbirth. We already knew that Black people disproportionately were dying from preventable disease like prostate cancer, cardiovascular disease. And so we knew that people were already being ignored, mistreated. We had published data from studies in 2018 already documenting the health disparities that Dr. Allison talked about earlier. We knew that the health system was not going to be responsive. And, quite frankly, the idea that we are even talking about COVID restrictions is a problem. We should be using the language of public health mitigation strategies, right? Even the language that we use to talk about where we're at in COVID-19 is reinforcing this notion that some people should be subject to restrictions and other people should not. Some people should get great care and other people should not. Some people should be prioritized by the health system and other people should not. I've heard the story, and Keith, I'm so sorry that happened to you and your family. As a nurse and as a public health professional, it is unacceptable. And I've published work to really document that healthcare, we need to do better. Public health, we need to do better. Our structures and our systems and our workplaces are inhumane. And so this idea that we allowed ourselves to get comfortable with health disparities when health disparities need to be resolved, and most of them can be prevented, that we are not fostering empathy in any given way, is a very real problem. That we individualized the pandemic and forgot that we're all in this together. And it was like there's a collective good that we all want to be able to support is really a problem. But it's not new, as our historians told us. This is how white supremacy works. And so, when I think about the Black women historians who have been documenting this, I want to put some more names into the room because Caretha Mitchell talked about this in her Know Your Place Aggression. She's talked about this in her book around why Black people can predict things like this in her book From Slave Cabins to the White House, Homemade Citizenship in African American Culture. She's talked about this. Dr. Cynthia Greenlee has talked about this as well. W. Kwamu Bell first came out and had the Conversation Project, again, talking about what Dr. Downs was saying. There's been Black activism on the ground. There's a COVID Black Project that's led by Dr. Kim Gallen, documenting the important interventions and the mutual aid. Remember, we were all talking about that in March, April last year, right? Documenting where Black people are really trying to emulate Black Panthers and following and taking care of our own. There are initiatives that are going on that are being completely ignored. So I am very grateful that the team at University of Georgia published their findings. But for people like me who knew and predicted this, it wasn't news to me. What's unfortunate is I'm glad they decided to use the power that they had in their study to be able to educate folks. around why it's so important that, we pay attention to these issues. I want to say one more thing about this whole children's book and, Ted Cruz and critical race theory and all of the misinformation around that. People are afraid of those things because they know that it's possible for us to grow, birth, and raise better humans. And better humans would actually make different decisions in pandemics than what we've already experienced.
You had a lot on your chest, Dr. McLemore. Get it out.
I've been sitting here listening to people and I've been taking notes because here's the thing, right? Principles matter most when they are hardest and the least inconvenient to stand by. Either we are our brothers and our sisters and our neighbors' keepers, or we aren't, right? Either leadership matters in this moment where we're not trying to grift around COVID-19 and return us to some urgency of normal, when normal never worked for any of us. I mean, Keith's family is a perfect example of that. There are millions of others. The returning to a normal that already was documenting health disparities for 20 years, that sounds like a bad idea to me. Yeah. Some of us wanted to go back to the future. We didn't want to go back to the normal.
Yeah, no, that's a great point. And what I assume, Keith, you went to that hospital in that rich neighborhood. Why'd you go there? It was just
it was the closest hospital to my mom. It was literally probably 4 blocks away from her house.
So she lived in the neighborhood where the richest hospital is.
Yes, ma'am. Couldn't get help.
Still wasn't respected as a member of that community, deserving of care in her community hospital.
Yes, ma'am. Pushed her away. Wouldn't even let her come through the door. So I have a documentary coming out that Oprah did. It's called The Color of Care. It comes out May 1st on the Smithsonian.
You're in the documentary?
Yes, I am in the documentary. Me and my mom, we both did it. Did it for
Oprah was watching the special report and saw how many times I had you on, and she said, "Let me get that guy, Keith." Oh, I'm so happy that you're in that. I've been talking to some of the experts that are part of that documentary, and I knew that she chronicled some families, but I hadn't seen who the families were. Keith, we lost your.
Yeah, I know. I can't. Trying to see. Let's see.
Okay.
There we go. Hold on, I'm coming back. There we go.
Okay, so you and your mom are in the doc. Okay, comes out May 1st on the Smithsonian Channel. Absolutely.
Yes,
The Color of
lost
Care.
me again. Hold on, I'm sorry.
That's okay. I'm so excited that your story is going to be told and that you get to share what happened with your mom. I know that the doc sits down. Oprah talks about being struck by learning herself about the disparities in the healthcare system that were laid bare because of COVID-19, and herself reading about a story of a Black man who had COVID symptoms, who died in his home because he couldn't get care at a hospital.
Yeah, that was my dad. That's my dad that inspired her for the story.
Oh, so Gary Fowler is your dad?
Yes, ma'am.
Okay, now I'm connecting that. See, I knew it was Gary Fowler, but I didn't connect it with you because of the different last name. Okay.
That's my dad.
That's your dad's story that she chronicles. Okay, and so she talks with you and your mom.
Yes, ma'am.
Wow, what was that experience like working?
It was cool. I wish it wasn't for that reason. It would have been better for something more positive, but it was a blessing to be able to be a part of it for sure, but it was awesome. It was awesome.
Wow.
Happy for the opportunity.
That's encouraging because I know Oprah, in addition to the doc, which is coming out, like I said, on May 1st, there's going to be a website, Color of Care website, and there's going to be this huge outreach to historical Black colleges and universities and to students, really trying to get students, in colleges and universities to understand this whole historical racism that happens in our healthcare system, to try to move the needle on some of this. What are you hoping, Keith, comes out of this documentary where you get to share to the world your personal story, you and your mom?
I hope it changes something, even if it saves one person. I feel like we changed the world. We save someone else from going through what we have to experience. So even if one person is helped, we did our job by doing it, the documentary. That's why Dad would want it.
Wow. Dr. McLemore, how important do you think documentaries like Color of Care is? There's another one called Aftershock that's coming out on Hulu. Again, for the first time, I think we're now seeing in more traditional media settings stories about racial inequities in the healthcare field, things that were talked about in colleges, universities, and academics. Now, the rest of the world, getting a chance to partake in. How important is that?
Well, I think it's super important. I mean, one of the promises that we were told around social media was this democratization of data, right? And this capacity to be able to have rapid access to information. And I always teach students and clinical learners, if Nazis, bots, and trolls are the only people that are using social media, we shouldn't be surprised when we have misinformation that's running rampant during multiple pandemics. So for me, this public scholarship, these documentaries, I mean, I want to remind people, when Dr. Susan Moore, a physician, died of COVID and documented her own mistreatment in the hospital on her Facebook Live page, that's when people really were starting to appreciate and understand this notion that you can be a physician, you can be, a citizen, you can be a random person, and we're all being mistreated in healthcare, right? In my field, in obstetrics and gynecology, reproductive health sciences, when Beyonce and Serena Williams all documented their mistreatment during their pregnancies, here's an interesting thing I always get students to remember. They survived, right? We are not appropriately collecting the right data. We're not disaggregating by race and ethnicity. COVID is far worse. Every estimate you see is widely believed to be an underestimate. So the more that we can have this public scholarship, the more we can have the media focusing on these individual stories, the more that we can have documentaries. Again, it builds that empathy gap that ties back to, the group in Georgia. How do we start to think about white people caring more about the lives of Black people? Well, how about we start doing some interventions to bridge the empathy gap?
But do you have any concerns, Dr. McLemore? You just gave some great examples of how African Americans, high profile, that have platforms, have used their platforms to tell their stories. But we saw from the University of Georgia study that the more disparity stories are told, the less empathetic white people are, not the more. So it's the opposite impact. So Oprah telling the story on Smithsonian, Hulu telling the story, and there are others. Is that really going to cause people to become more empathetic, or to say even more like, oh, I really don't care about this because now they're taking up my TV time and I should be watching football or something?
Well, the reason I'm the editor-in-chief of Health Equity, I don't use the word disparities, right? So disparities, describing differences among and between groups, those data are really important and crucial and can help us make decisions around policy. But some of our language that we use for the public, maybe it's not necessarily so much highlighting disparities, but it's those individual personal stories, and it's those group stories like Dr. Downs talked about in terms of, clinical physician and public health and nursing interventions to have communities caring for communities. Maybe it's not necessarily so much continuing to highlight and document differences and disparities, but maybe it's the narrative around the fact that many health disparities are preventable, and that they require intervention. And a lot of those interventions are policies, and that the ways that we allocate resources, whether it's humans, money, space, or time, can lead to more health equity, right? So it's important to do a both and, right? We have to keep talking about disparities, but we also have to give people insights and hopes around the interventions and the strategies that will allow us to resolve these disparities that don't involve stigma, shame, judgment, or blame of any individuals or any different groups, right? We can figure this out.
No, I have no doubt that we can. It's not easy, but I do think there's a solution, and the solution is probably in the problem. Keith, have you had a chance, when I asked you about, we're running out of time, but have you had a chance to see the whole documentary?
They actually emailed it to me this morning because I got invited to come to the Smithsonian for the premiere in Washington, D.C. So I'm watching probably later with my mom and my brothers and them. So
how does your mom feel about it? What were her thoughts about it?
At first, she did not want to do it. She was not for it, but she did it.
Was that because she felt like it was too personal, or it's too soon because her husband?
And she just felt like, what's the point? Like he's gone. What's me talking about it going to do? I just talked to her, told her to help her to get it out. And maybe we could help somebody else not to go through it. So she did it. she's happy. She's in a better place now than she was 2 years ago, because today is the second year that they died. So
Today is their anniversary of their death?
yes, ma'am. Yes, ma'am. So she's in a better place. I think we all are, but just one day at a time, you know. I mean, it's still days I cry over them for sure. You know, I cried earlier, but it's just life. You know, it doesn't get easier when people die. You just learn to deal with it, you know. So just one day at a time, trying to be a positive outlook for someone else, you know. That's all you can do.
Oh my God. I feel like I need to come to Detroit and give you a hug, because I had no idea this was the 2-year anniversary of your dad and your granddad's death. And like I said, I've been talking about, we're doing a show with the expert, Dr. Neil Shaw, who's in the co-op care. We're going to air it after the documentary runs. So I've been talking about it and reading about the doc, and I saw the name Gary Fowler, but I didn't make the connection to you. And when we were doing this show today, I told my producer, find Keith. He's like the guy that has suffered the most, but that has the most positive spirit about all of this. I mean, I know you have to have anger and bitterness, but you come off so even and so empathetic, the way we want these white people that think it's not their problem to be. And hopefully they see you in this documentary and see how much love you're giving, despite how you were treated and your family were treated. Maybe that'll touch somebody.
Yeah, I hope so.
Cause someone to say, maybe I can wear that mask. Maybe it's not going to kill me to wear that mask.
Wear that mask for that 10 seconds. You know?
Yeah. Wow. We're going to leave it there, Keith, because I just got so many emotions. I want to see the documentary. I want to come to Detroit.
Come to visit.
Figure out me a trip to Detroit to meet you and hug you and just embrace you. Just thank you so much for how you have been so open and sharing your story. Thanks to your mom. I haven't even met her, but I love her already too. So thank you guys for being willing to be open about this and to share it on a big screen and on this screen. And you've been such a gracious guest. Every time I call, you just answer. And it does help to talk about it. So, and I'm glad Mom decided to do so. Thanks to all of my guests. Have been incredible experts who've helped us understand what's happening around COVID and the history of medical care and healthcare racism in this country. So important to have these conversations. I hope this episode gets shared widely on social media, because we touched upon so many important issues. And just some words to live by before I get out. The arc of the moral universe is long, but it bends towards justice. That's from a portion of a sermon that Dr. King gave. And we know that's one of President Obama's favorite quotes. He used it so much. He loved it so much that he had it embroidered on a rug that was in the Oval Office, because he wanted people to understand that the fight and the journey for justice and liberation and freedom doesn't happen in one presidency or one generation or one decade. It's a long fight and it's a long journey. But what he wanted us to also be reminded is that we could get there, and we could get there together. And I am so hopeful after this show today that with the kinds of brilliant minds working, and the kinds of people like Keith and his family who are willing to share their stories and who have so much empathy despite having suffered so much tragedy, that we together will get there. Be safe out there. I'm out.